If you want to learn everything you need to know as a nurse about decompression sickness, then this is the video for you. Decompression sickness is a rare condition in which nitrogenous gas bubbles form in the venous bloodstream and various tissues. Nitrogen, which makes up 78% of the Earth's air, normally diffuses across the alveoli along its pressure gradient, moving from an area of higher concentration to an area of lower concentration, to either be dissolved in the blood and bodily tissues or exhaled. When the pressure gradient favors the elimination of nitrogen, nitrogen exits the tissue or blood it was dissolved in and forms microbubbles in the venous circulation. These nitrogenous microbubbles then travel to the lungs where they are easily diffused across the alveoli and exhaled. This process does not cause any problems. However, decompression sickness can occur when there's a strong pressure gradient favoring the elimination of nitrogen, as it causes an increase in microbubble formation. This in turn increases the risk of bubbles merging together to form large gas bubbles, which can become trapped within the tissue in which they were dissolved in or become venous gas emboli. Venous gas emboli generally travel to the pulmonary circulation, where they become lodged and block blood flow, resulting in pulmonary embolism like sequelae. If you want to learn more about venous gas emboli, then click the link on screen or in the description down below. Atmospheric pressure, or the weight of the atmosphere, directly affects the pressure gradient of nitrogen, as it changes the concentration of nitrogen in the air. The greater the atmospheric pressure, the greater the concentration of nitrogen, and vice versa. Atmospheric pressure and thus the concentration of nitrogen increases with water depth and decreases with elevation. Therefore, diving can cause decompression sickness. In specific, if the ascent portion of a dive is completed too quickly, when atmospheric pressure and nitrogen concentration are decreasing, creating a pressure gradient that favors the elimination of nitrogen from the body. This process is comparable to the bubbling scene when a can of pop is opened. The risk of developing decompression sickness is increased with increased diving depth and length, decreased descent time, dehydration, high body fat, and cold exposure. Signs and symptoms of decompression sickness can appear immediately after diving or up to 12 hours after, and in most cases are mild, with the most common being joint pain and itchy skin due to bubble entrapment within those tissues. Severe cases of decompression sickness present with neurological and respiratory symptoms. Neurological symptoms such as weakness or paralysis, abnormal sensations such as numbness or tingling called paresthesia, and bowel or bladder dysfunction can occur as a result of gas bubbles collecting in the veins near the spinal cord, resulting in a venous infarct. However, cerebral neurological signs and symptoms are possible as well, such as confusion, decrease in level of consciousness, change in mental status, and visual disturbances. And finally, respiratory symptoms such as varying degrees of respiratory distress, poor oxygenation, chest pain, and a cough occur as a result of venous gas emboli becoming lodged within the pulmonary circulation. Diagnosis of decompression sickness depends heavily on a history and physical exam, because decompression sickness lacks specific diagnostic criteria or tests. Rather, some diagnostic tests may be completed to gather information to either prove or disprove the diagnosis. Treatment of decompression sickness is focused on early intervention to decrease morbidity and mortality, providing 100% oxygen as it helps the body eliminate nitrogen, and depending on severity, recompression therapy in a hyperbaric oxygen chamber. A hyperbaric oxygen chamber is a controlled pressurized environment that provides 100% oxygen. The pressure within the chamber is gradually reduced with designated pauses to allow for the elimination of nitrogen. Sometimes several treatments in the chamber are required. However, recompression therapy is contraindicated in the presence of a pneumothorax or inner ear barotrauma, both of which are possible injuries that can co-occur with decompression sickness as a complication of diving. Residual deficits are possible from decompression sickness. However, most have a complete recovery with timely intervention and treatment. Prevention of decompression sickness includes safe diving practices, such as limiting diving depth and length and using a dive table or computer to guide ascent speed and safety stops. Additionally, flying or traveling to high altitudes is discouraged 24 hours post-dive. This wraps up everything you need to know as a nurse about decompression sickness. I hope you found this video useful, and if you did, please show your support by giving this video a thumbs up, subscribe, and hit that notification bell so you never miss a video. And please leave a comment down below if you have any video requests. Thank you, and bye!